Good morning, everybody. Nice to see you. Let me get as usual, I forgot to check my sound, see if my sound's on. Okay, now I have sound on. Okay, very good. Hey, and there she is. Let me invite you, Alyssa. Here we go. Good morning. How is everybody today? I hope you're good. There's Alyssa right there. Look how beautiful you look.
Oh, thank you.
I love your lighting. What kind of lighting do you have?
It's a ring light. I just threw up a ring light. So,
Oh, it's just that your skin is that gorgeous.
Well, I had some makeup help this morning. That was nice, at least.
Well, it looks beautiful. Hey, thank you for being on. We had so much fun this morning. It was really, really good.
Yes, thank you.
Yeah. Well, listen, while people are joining, I'm just going to start out with here. This is all about summer skincare, but also just skincare in general. If you have any questions at all, Alyssa is really good. I go to her all the time. So I just want to start out with one thing. I was thinking a lot of women, I said, like me, we laid out in the sun, etc. What can we do at this point? I know, well, why don't you just talk generally, and then you can talk maybe about some things you've done with me just to repair as much as possible.
Yeah.
Hey, Alyssa, there you go. Okay.
I go.
Are you connected to
Can
Wi-Fi?
you see me?
Yeah. Are you on your Wi-Fi?
Yeah.
Okay.
I am on my Wi-Fi. See, I hit something. Can you see the camera of me?
Yeah, you're good. Yeah. You disappeared. There you go.
I can't see myself, but that's okay.
I can see you.
Okay, perfect. Okay.
You're fine. Okay.
So obviously there's two different parts of medicine I practice. The medical derm that you see me for. So people get brown spots and scaly spots, and we can freeze those things, which is something we've done on you. And those are all little things that you can do on the dermatology side. And then of course there's the aesthetic side. And there's so many things. We have resurfacing lasers and micro needling. And I always equate this to, you have, 30 plus years of sun damage. There's not going to be one treatment that is going to fix those 30 years. We're talking about, you need to do maintenance at home with good skincare, maintenance in the office, getting your skin checked, making sure there's nothing medically wrong. And then obviously all those aesthetic services too are super important.
Right. Well, when you were talking about brown spots, and for instance, one of the problems with treating those, getting them frozen or whatever, which you have done on me, but like a lot of people like me, I can't be off camera for 2 weeks or whatever. So I actually got out of my refrigerator this stuff why don't you tell what this is, because this has worked wonders on my face.
Yeah, so I know we've always toyed with finding exactly when you're not going to be on camera enough time to actually freeze some stuff, which is impossible for a lot of people that are forward facing. So we can prescribe a compounded bleaching cream, which is what you have, which has an active ingredient called hydroquinone, which is a skin bleaching agent. And it won't take you fairer or whiter than you are. It will just take down the pigment back to your natural skin tone. We also, we compound it with some retin-A and kojic acid, which is another good skin prepper. And then it's got a little steroid to prevent some of the irritation. But that is probably the top thing I prescribe for brown spots and pigmentation and melasma. It does need to be prescribed by somebody who knows what they're doing. You can get it now. You can get these things online now or in Mexico, but hydroquinone, if not used appropriately, can actually cause damage. So you don't want to use it for more than about 4 months at a time. Appropriate sunscreen use, super important, but that is an awesome thing that can be prescribed. This is prescription only. The strength we have for you is pretty strong, but it works, as you know, it works amazingly well for stuff like that.
It does really, really well because I guess my skin, I've got a little bit of an olive skin. So it's prone to those brown spots, that kind of thing. And so it's worked really, really well for me. And as you're joining, if you have a question for Alyssa, just feel free to text it, and I'll try to catch it here as we go on. But one thing I'm curious about, I've done a lot of other things, but I haven't done any laser treatments. And I get confused by what there is, what it's good for. Can you just give us a little primer on laser stuff? What is for what?
Absolutely. So there's two big types of lasers in the world. There's ablative lasers, which break the skin barrier, usually with a laser called erbium or CO2. And then there's non-ablative lasers, which are much more common, like IPL and other things that people hear out in the world. We have an ablative laser called UltraPulse, and I did it back in the fall, and I have a whole highlight reel on my Instagram. It takes years off of your skin. It is aggressive. There is a decent amount of downtime. It's not cheap. But if you ever have, 10 days ish to hibernate, it is one that will really help with all of those fine lines. I mean, really just take several layers of the skin off. Big time, serious laser. Most people don't have time for that though.
Okay, before you go on, I want to interrupt you for just a second.
Yeah.
So, like, for instance, you've seen my face in person. You know what? So on my face, what would that laser do?
You are a great candidate for it because you've got great skin, but there's years of all this sun damage that we need to reverse, softening up some of those fine wrinkles. I mean, I know you do other things, but this is one of those big major, I hate to position it as one and done because people will do them, but if you are looking for a big, aggressive, downtime type laser, this is the one. There are not a ton of people in Dallas that have it either, just because it needs to be done. But actually our physician, Dr. Cather, does it because it is so aggressive. You want to make sure it's in the right hands. So this isn't something that's going to be done at a med spa or anything like that. But for you, brown spots, softening up the fine lines.
Yeah, the fine lines that are just from years of,
Yeah.
like I said, when I was 18 or 20, we didn't protect our skin. We darkened our skin,
Yeah.
So, and there's damage from that. So that would be good for me. What was that called?
It's called UltraPulse. Text me. We're going to find you a time to do it, Jane, and then you can record your whole series. You just need you're not going to be able to go on camera with it. So you will definitely have to find a time when you're off for about a week.
What does it do when you say I'm not going to be on camera?
So,
I mean, I've done everything. So
it takes the top layer of your skin off. For the first few days, the skin actually almost weeps. So it gets, I literally did it on like a Wednesday afternoon. I did work because I'm in the business, but I scared a bunch of people. My kids were scared. And then the whole weekend I took off. You have to wear sunscreen if you go outside, but it almost hurts. So you don't want to wear sunscreen. Weepy and then swollen. I was pretty swollen, but by about 7 days, I mean, besides a little bit of peeling, you're back to,
right.
Okay,
well,
so.
and the thing of it is that, you know how careful I am. I'm very, very, I'm really very careful about what I do, but I trust you because I know that you know the science of it and all that. So I'm kind of interested in that. Okay. So I interrupted you. You said that's one kind of laser. What else is there?
So then there's non-ablative lasers, which are much more common out in the world. I would say the most popular laser that has the most recognition is IPL or photofacial. Minimal downtime, targets brown spots. We do know that it helps with a little collagen induction, a little bit of textural stuff. People that are really red, rosy, rosacea prone type people, it works really well for. We also have a picosecond laser, which targets more melasma or that pigmentation that Hannah was talking about earlier. That's a tougher pigment to treat, and a lot of lasers are actually you can't use with this, but Pico is one that you can. We have a line called Luminous, and so we have basically every luminous laser that kind of targets, from everything aggressive down to light. We've got their laser hair removal too. I'm trying to think. Oh, and then we have an M22 that has a non-ablative resurfacing. So for somebody younger, say somebody like my age that's actually done decent with sun protection through the years, but I'm almost 40, starting to see those fine lines around my eyes, no matter what I do, we have a non-ablative resurfacing laser that is not as aggressive, not as much downtime, but will soften up those things that
I'm gonna tell you, your skin looks like you're 18, and I'm not just saying that. Your skin is amazing. Okay, I've got a couple of questions here. Someone wants to know, I think they're talking about the laser you described for me. Is this treatment like a chemical peel? And then another wants to know, and I get this question a lot, what about lines around your lips? If you smoke, you didn't smoke, what can you do about lines around your lips? 2 questions.
It is much deeper than a chemical. The CO2 laser is much deeper than a chemical peel. There are some pretty deep chemical peels, but this is going to be deeper. The laser actually creates tiny little micro channels in the skin or microabrasions in the skin, whereas a peel is just a chemical that you put on top of the skin that encourages the skin to peel. So much deeper. In a peel,
Okay.
I mean, a peel, we're talking max a couple $100. This laser we're talking about is thousands. So a very different thing.
Okay.
Lines around the mouth. You can use Botox. You can use filler. Good skincare. There are specific skincare products that have hyaluronic acid and things that kind of prep the skin and plump them out a little bit. Microneedling is also another service. It's a very popular service we do that's great for fine lines all over. It's a tiny device that has all these little needles that goes all over your skin. It takes about 30 minutes. Our esthetician does it. And that creates little micro channels that help induce collagen and soften those things. Again, we're talking many things needed to target this.
Right.
But starting with good skincare and good sun protection. And the most important thing I want to hammer home is make sure you trust who you're going to. There's a med spa and a skincare expert on TikTok in every corner now. And people can get dangerous things in their hands and think they know what they're doing. So again, a good trusted source, of course. I'm a little biased. I work in a dermatology office. We have a great medical director and long-standing estheticians, but be careful who you see.
Okay. Kathy Harris wants to know, hi, Kathy. What about BBL? What is it?
BBL is essentially the same thing as IPL or photofacial, what I mentioned. BBL is actually just a branded term for a laser called Cyton. We don't carry Cytons. We have a different, it's like Kleenex versus tissue. We carry a different line, but BBL and IPL are essentially the same thing. Target brown spots, red, a great just overall easy laser.
Okay, another question, and I'm going to say something about this first. Someone says, can you fix bags under the eyes without surgery? I will tell you that in my experience, bags under the eyes have a lot to do with what I eat or drink. If I consume a lot of sugar or wine or things like that, would that make sense to you?
Yes, it's such a popular.
What do you do to fix them if they're serious?
Under eyes are the hardest thing in dermatology. Surgical is typically, if you have serious big deep bag surgery, is probably your best option. That laser that I mentioned, again, the Big Daddy CO2, we actually can put metal contacts in your eyes to shield, and we can use that deep laser all around the eyes to do sort of a non-surgical lift and softening. It scares people because you have to put metal in your eyes because you don't want the laser to blind you. But that is something that's non-surgical. Allergies, hydration, sleep, all those things can contribute to under eyes. So there's lots of things with that. I tell people find a good concealer. I know that's catty, but there's so many things. There's a million eye creams out there. Some are decent, but again, eyes are tough.
Okay, someone wants to know, you're going to need to give a shout out. I know you are, because someone wants to know, says, your makeup is flawless. Love to know your routine. And I know you had somebody do it this morning. Who did it?
Yes, shout out. I actually used an app called Birdie. One of my friends told me about it. It's a local Dallas group of women, and you can go on there and put your time and date that you need, and somebody comes to your house. So it was brilliant. I never heard about it before. Makeup by Maybel, Maybel. I tagged her earlier, so you'll see her on my Instagram. She was at my house at 6:45 this morning, brought the whole setup, 45 minutes. I mean, I told her I could get used to this. And thank you for whoever said that.
Someone else, and again, I always on you're someone I have used for years, and I only would send somebody to somebody who I know is good, like you, but I'll be happy to do this. Somebody wants to know, how much is a consult with you? How do you work that? I don't even know.
I am a medical provider, so most people will come in for like a full skin exam. So we usually run everything through insurance. If you are self-pay, we have self-pay rates depending. So I don't have like a fixed consult fee specifically, but it'd be more like if you go to a doctor's office, but you can request just specifically a skincare consult. And we do have a fixed like $75 skincare only consult. If it turns into medical, then we do bill your insurance. So mostly we go through insurance.
Okay. This is a good question because you see those, and I'm not going to name any names here, but you see those creams that say that they'll tighten your neck skin.
Mhm.
Do those topical creams really tighten loose neck skin and assist with wrinkles? And what is it? Is it Strivectin? I think that's the one that we see all the time advertised.
Yep. Strivectin, super popular. And then of course, all the skincare companies now that we sell, everyone has a neck cream. Necks, again, like under eyes, are hard. We have much less oil production and sebaceous glands in our neck. So it's not hydrated enough. So as we age, we decrease our oil production all over, but our neck really does. And then think of all the things. We're good about putting sunscreen on our face. Do we remember to put sunscreen on our neck every day? No. We're looking at our phones. We're staring at computers, those lines. I mean, I've taken a really good care of my face through the years, but I'm even starting to get these lines. It's like, so the creams probably, again, creams to correct are much harder than creams to prevent. Once you're into the correction phase, you're looking at doing more, aesthetic type treatments. But there are some, like Nectifirm by Revision. Revision's a Dallas-based company. They have some good data to support tightening. Skin Better now has a new neck cream. So there are some. I just think depending on how much money you want to spend is always the question. But again, don't expect miracles with them.
Okay. And a couple of people have asked how to find you, and I am going to get to that in just a minute. Talking about the neck, now you don't do this, but upstairs from you, I have had the Morpheus 8 treatment,
Yes.
which has worked really well for loose neck skin. So just if you're watching, that's something I've had done. Okay. Someone says, I had 2 IPL brown spots coming back. What about that? If you have the IPL and they're coming back, do you have to just continually do it? Or is there a treatment that's better at getting rid of them for good?
There's nothing. The sun is going to keep our brown spots coming. And unless you hibernate from the rest of your life, you're going to continue to have those assaults. So there is no skincare cream, laser that is a one and done. This is all about, our office manager always talks about maintenance. So lasers are like the oil change. And then you've got your skincare maintenance at home, getting you to your next oil change. So it's not unusual that your brown spots are going to be coming back. Are you reapplying your sunscreen every couple hours? Are you wearing a wide brimmed hat? Are you a major tennis player that isn't reapplying? There's so many factors. So it's not unusual for brown spots to come back. And a lot of people a lot of my IPL people will do like 3 in the fall after the summer, do really good skincare all winter and summer. They know some of the brown spots are going to come back, and then they go back to the maintenance phase. But that's not unusual, especially if you're not tuned into the right skincare at home.
Okay. So before I let you go, just for women like me who are well above 40, I can't believe you're going to turn 40. You do not look like that.
Next year.
Oh, wow. So for women like me who are sitting here and looking, and whether it's fine lines, whether it's brown spots, we all have the same issues, frankly. It's all the same. So what are a couple of things that you would suggest that we really consider to do to correct
Yeah.
the damage that's been done before we knew not to do it?
Yes. If you are not using a retinol or a retinoid product at home, then everything else is null. So getting we can do a prescription, which your compounding cream has the retinol in it. That is vitamin A. What it does is it increases skin cell turnover, FDA approved for fine facial wrinkles, texture, tone, pore size, all those things. So a retinoid at home, you can get it over the counter, Differin, Rock Retinol. My personal favorite is Skin Better Alpha Ret. I can prescribe you tretinoin or Retin-A. That's number one. That's at night. Of course, sunscreen every day. We talked about vitamin C's on air today. Those are great too. So good, solid skincare regimen. You don't need 17 steps. You need about 3 things. Remembering to reapply when you're outside for longer. And then again, find somebody you trust. I know you see me. I know you see David upstairs. They have that Morpheus 8. Your neck looked incredible. I remember after it. I love that treatment. Find somebody you trust that knows what they're doing, that knows the risks and complications if you are getting filler or Botox, because some of these things can have permanent lasting effects. Lasers in the wrong hands, again, can be really scary. So find an esthetician or a PA or a doctor that knows lasers really well, and get on sort of a maintenance regime of, an IPL once a quarter, or microneedling or things like that. So there's lots of things you can do, but find somebody you trust. I talk a lot on my Instagram. That's kind of how I grew this thing about skincare and giving legit advice. And I think I've helped a lot of people in that respect. So again, find somebody you trust.
Okay. So where do people find you?
I am at Mindful Dermatology. Our phone number is 214-265-1818. And we are just at Plain and
Make you say
Simple.
that. I'm going to make you say that again because I'm sure people are scrambling for their
Yeah,
pens.
sorry. How about Instagram? At Mindful Derm Dallas. And then I'm at the Dallas Derm PA. Our phone number is 214-265-1818. And you can call and schedule a new patient appointment with us. And then we have a whole aesthetic service. I've got great estheticians, and we can do skincare. We do everything from skin cancer screenings to the whole gamut. So we're happy to take care of everybody from young to old.
I am so happy to be able to connect you with people who watch me this morning. Thank you for your time. Really, really appreciate it. And hey, have a great day, okay?
Thank you, Jane.
See you later. Bye.
Bye-bye.